Greetings viewers and welcome back to the review program. Uzbekistan is undergoing significant reforms in its healthcare system. These reforms aim to improve the accessibility, quality, and efficiency of the healthcare services. In this episode, we are going to talk about these reforms in the sector. Before we proceed with the reforms, let's analyze the healthcare system. The healthcare system in Uzbekistan is organized into three main levels: primary care provided through rural health posts, polyclinics, and family clinics. These facilities offer general medical services, preventive care, and basic diagnostics. Secondary care includes district and city hospitals that provide specialized outpatient and inpatient services. Third care comprises specialized hospitals and research institutes that offer advanced medical treatments and research. The Ministry of Health is the central body responsible for healthcare policy, regulation, and oversight. It works in collaboration with regional health departments to implement policies and manage healthcare. Now let's move on to reforms in the healthcare system. Over the past 7 years, the financing of the healthcare system has increased 6 times. Hospitals are being equipped with modern equipment and new ones are being built. To bring medicine closer to the people, local screening examinations are being conducted. Analysis shows that only 30% of population's requests in this area are solved at the primary level. Some diseases are treated using outdated methods. The range of tasks that nurses can perform is limited. In this regard, based on the international requirements, treatment methods for 7 diseases that are the most common today have been updated. In May, President Shavkat Mirziyoyev got acquainted with the presentation on the activities and new proposals of the Center for Healthcare Projects. In particular, the center has developed proposals to improve the primary health care and emergency medical care system, introduce state medical insurance, and streamline the procurement of medicines. A state medical insurance will be introduced in the capital. The system will be financed by the general taxes paid by citizens. No additional fees will be charged from the population. The health insurance will include a guaranteed package of free medical services and medicines provided by the state, a system for referring patients to specialists of narrow profile or to hospitals through assisted family doctors. Free medical services will be provided only if this procedure is observed. Medicines within the guaranteed package free of charge through pharmacies on the basis of an electronic prescription for the treatment of the most common diseases. The healthcare certainly goes through many reforms. Why do we need the insurance? Why wasn't it introduced in the previous years? How about the digitalization of medical services? To discuss these matters and more on this sector, we have invited a special guest. Good evening, sir, and welcome to our studio. We're really happy to have you here today.
Thank you very much. Thank you for the invitation.
Before we proceed with our discussion, let's watch a small report about our topic.
President Shavkat Mirziyoyev got acquainted with the presentation on the activities of new proposals of the Center for Healthcare Projects. In particular, the center has developed proposals to improve the primary healthcare and emergency medical care system, introduce state medical insurance, and streamline the procurement of medicines. The presentation comprehensively analyzes these areas. Over the past 7 years, the financing of the healthcare system has increased 6 times. Hospitals are being equipped with the modern equipment and new ones are being built. To bring medicine closer to the people, local screening examinations are being conducted. Analysis shows that only 30% of the population's requests in this area are solved at the primary level. Some diseases are treated using outdated methods. The range of tasks that nurses can perform is limited. In this regard, based on international requirements, treatment methods for 7 diseases that are most common today have been updated. Another 300 clinical protocols will be reviewed by the end of the year. Routine examinations and non-drug therapies for patients will be transferred from doctors to nurses. In polyclinics, the routing of the patients will be streamlined, which will reduce the waiting time in the queue for appointments. 3 years ago, a medical insurance system was introduced in Sirdarya as an experiment. It revealed many shortcomings in the sphere. Due to insufficient digitalization of medical institutions, the insurance system does not function properly. A lot of doctors' time is spent on filling in reports. In this regard, a task has been set to create a model of digitalization of the sphere in Tashkent. For this purpose, all institutions will be equipped with the new computers and technical means. The electronic polyclinics and electronic hospital systems will be launched by the end of the year. Following the fulfillment of these activities in 2024, the mechanisms of state medical insurance will be introduced in the capital. The system will be financed by the general taxes paid by citizens. No additional fees will be charged for the population. Within the framework of the health insurance, a guaranteed package of 3 medical services and medicines provided by the state will be introduced. A system will be organized for referring patients to specialists of narrow profile, to hospitals to assign them family doctors. Free medical services will be provided only if this procedure is observed. Medicines within the guaranteed package will be provided free of charge to the population through pharmacies on the basis of electronic prescription for the treatment of the most common diseases. During the analysis of the emergency medical aid system, it was noted that the main problem is related to the lack of sorting of requests by the severity of disease. In this regard, a decision was made to establish medical consultation of patients through ambulance call centers. This year in Tashkent and next year in other regions, a team of paramedics and pediatricians will be created. Employees of the system will be retrained as a consultant physicians, called triage operators and paramedics. Instructions were given to improve the list of medicines and medical devices produced on the basis of direct contracts, as well as the procurement process itself. The head of state emphasized the importance of preventing diseases and increasing people's sense of responsibility for their health through the wide promotion of healthy lifestyle ideas in society.
So my question arises here, looking at this report, why do we need health insurance? Why wasn't it introduced before? And what did doctors use before the system was introduced?
Well, that's a good question. We need health insurance because it's very important that that a patient who is sick, that a person who is sick will get a minimum standard of treatment. And if previously we always told that the medicine, the medical services are free, but in the end of it all, nothing is free in this world. And anyways, it was paid from a governmental budget. I will tell from my perspective, what would happen is, for example, for a national cancer center, they would give an amount of money which is enough for 10,000 people. You treat 10,000 people by November, and then the rest 2,000 or 3,000 people would be left without a care because you don't have budgeting for that. And the insurance system partially solves this problem. And the other part is healthcare is expensive. Treating people is very expensive. So it was very important to have some pillow of money for you just for accidentals. But now, if we introduce this, the insurance system, we will make sure that everybody, regardless their income, will have guaranteed pack of services, of medical services. And the other important part is we have chosen a little wrong path to treat everyone. Treating everyone is impossible. It's a very expensive procedure. So it's much better to prevent. If you remember back in 90s or 2000s in the United States, we had an overall view that all American people are big and fat. And then the insurance system started a big campaign of losing weight, and it worked out. And the other brightest example would be South Korea. They have greatest insurance system, which makes people to go for checkups once in a year or twice in a year, depending on the age and the region. But overall, for an insurance system, it's much more effective to prevent some diseases if the disease has started, to catch it in initial stage and to treat it, because it's gonna be tenfold, if not more, cheaper than to treat advanced disease. So, the reason why we came to it now is because I think last 7 years we have increased enough capacity we have done the pilots, and the main thing is the attitude have changed. What I mean is, a long time ago, we did not have a right to make mistake. Mistake would be equal to a punishment. But now this paradigm have shifted. We're like, if we are making mistakes, then we're not looking for punishment. We're looking for lessons. Like, okay, what we have done wrong, and how can we fix it in order not to repeat it in the future. The same lessons we have learned in Sirdarya region, and now we have increased the piloting of a insurance system to national centers. National Cancer Center is part of it. So and now so far it's going very well.
Digitalization is one of the most significant changes that happened to the sector, and for sure, after this traditional methods like paper methods that doctors used for so many years, what are the pros and cons and maybe challenges that doctors may face during this period?
Digitalization is yet to come. Let's be honest. We have a small time to finish it up until the end of the year. Just for you to understand, if you have a big chaos even in your paper documentation method, then if you digitalize it, then you will digitalize a chaos. So that's why first step would be to structurize the chaos that you have in your documentation system, and then digitalize it, and then educate the professionals how to use it, what to do it, and how to precisely address the issues. One of the greatest examples, I am part of that project, is a cancer registry system. We want to register all the cancer cases throughout the whole Uzbekistan, and follow the trends over a year. What will it give it to us? Let's say stage 2 gastric cancer, assumably in Sirdarya region. The treatment and survival rate is 90%, but stage 2 gastric cancer, let's say in Jizak region, is 50% or 60%. So then we will have instruments and tools to determine what is the problem. We have the clinical protocols, we have clinical guidelines, and they are the same for these two regions, but the effect from using these protocols and guidelines would be different. And then we could analyze it and find solutions. There might be a problem with capacity building, or problem with procurements, or problem with drug delivery. So all these cases would help us to improve the healthcare and provide best quality health services. Besides that, we are finally, as a doctor, I would say, finally getting rid of these papers, because anyways, we're doing it on computer. We're opening a file, we're writing it, saving it, and then printing it, and then gluing it to a paper form, just because it is law to fill that. But now, if we have nationwide health information system, or medical information system, or hospital information systems, then we can just do everything online, and there would be no need. For example, me as an oncologist, as a professional, I need to know my patient's background in, let's say, endocrine diseases, or other traumas, or other surgeries that patient has had. And it's not always possible to bring those, files with you. So what I could do is I could go to his health records and find it out. And the last, and to my view, the best benefit from digitalization of everything would be digitalization of a pharmacy. It's it's habitual in our country. If a person gets sick, he would go to a drugstore, to a pharmacy store, to ask, I have a sore throat, what would you advise? Give me an antibiotics. And the drugstore person would give antibiotics without a doctor's appointment. So if the prescription system will be digitalized, then we will understand who is prescribing what kind of drugs. Are they within the standards? If they're out of the standards, why is it out of the standards? So this way we could help misuse of drugs and medicines in Uzbekistan.
In some developed countries, people cannot get the medicines without doctor's prescription. Do you think this could be implemented in Uzbekistan? May it have any drawbacks?
I hope that after digitalization, that will be implemented because we are one of the few countries where you can go and buy antibiotics or other drugs for diabetes. Look at any drug, you can buy it in a drugstore without a prescription. And that could potentially bring to a misuse. Yes, it's very important to put the system on a track, but for this we need the digitalization first.
Are there any challenges or common issues in healthcare that need to be addressed in your view?
One of them is digitalization. As I said, it is yet to come. The second is capacity building. It is also being addressed. Like I can tell the things more in detail about the oncology since I work there. So since 2017 up to 2020, before pandemic hit, we sent 40 specialists in oncology outside so that they could have a chance to go to observership programs to see how things work in developed countries and what can we take it and implement over here. And the last very important part is incentives. Doctors and teachers traditionally are the lowest paid professionals in Uzbekistan. And I really hope that that it will be addressed in a near future because the private sector is developing very fast. So if you are a great professional, but you do not have enough income, you would go to a private practice, which would give you more income. But the suffering layer of society would be those people who cannot afford to go to private clinics. So that's why this is one of the biggest issues that we yet need to face.
Mm-hmm. Let's move on to oncology. What is the condition of this area for now?
We have achieved a big success past years. The condition was critical when I came to work. It was in 2015, and the critical condition did not depend on people. For the whole country, we had only 5 radiotherapy devices for the whole country. WHO recommends to have 1 radiotherapy unit for 1 million population in developing countries and 1 radiotherapy unit for 500,000 population in developed countries. So now the amount of the radiotherapy in Uzbekistan is 29. So this is only for radiotherapy. Chemotherapy, these are the caterpillars of oncology, right? You treat with the chemotherapy, you treat with radiotherapy, you treat with surgery. So chemotherapy, it was the demand would be covered about 10 to 15%. The rest of the medicines should be procured by people out of their pocket. But now the first and second line of chemotherapies are fulfilled with 90%. So only 10% in some cases people have to copay or people have to pay out of their pocket. Then I have already told about the capacity building. In 2022, we have sent 50 doctors to South Korea for short-term and long-term education. And 27 of our professionals went to Turkey. And it's still this is continuous education. Besides increasing the doctor's capacity, we started increasing the managerial capacity. Let's say, like we have specialists who know how to create a national cancer control plan or to implement screenings or early diagnostic methods. And with that, the next achievement of oncology in last years would be implementing nationwide breast cancer screening. It's such a great initiative. We screen all the women 45, 65, and then we identify those who have precancerous diseases and those who have early cancer stages, and then we treat them. It's much cheaper and most efficient. The therapy would be the most efficient in the first and second stages. We have piloted screening for cervical cancer for a colorectal cancer is yet to come. So these are the main achievements that we have had. We are going from open surgeries to more laparoscopic surgeries. The biggest achievement, I think, of creating state-of-art center, National Cancer Center is moving this year, hopefully by the end of the year. We are moving to a new building with 750 beds. And so it's going to be state-of-art center, to my knowledge, the only one in Central Asia who could provide this diversity of medical services for cancer patients.
Do you have any figures for survival scale?
Survival rates?
Yeah.
Survival rate in cancer is a very tricky question. Why? Because if you ask me survival rates in a breast cancer, if it's first and second stage, I would say survival rate is more than 95%. If we talk about pancreatic cancer, then even in third stage, 5-year survival rate is less than 5%. Yes, we have overall survival, which is close to 60%. It's 55 point something. But it doesn't give the whole picture of cancer survival rates. But there are other estimates that you can see and make some conclusions. It's like late stage cancers. Okay, so we had more than 20% of patients addressing in the late stages back in 2015 when I have started working. But now this number has decreased to 14%, which is a little bit for 1 or 2% higher than the world mean. But still, it's a big progress. Plus, we had 20% shift to a first and second stage. You know, it shows that people started caring about their diseases, and people found out that the medical services are available, so that they will go and check and find out the diseases in more early stages.
What are the most common cases, and what are the reasons behind these cases, most common ones?
Okay, the most common case in both sexes in Uzbekistan is breast cancer. The second one is cervical cancer in women and stomach cancer in men. Then it goes colorectal cancer in both sexes. The main reasons, it's when you talk about the reasons in cancer care, it's really hard to highlight one reason and saying that it's this reason that caused cancer. But the overall reasons are aging. People of Uzbekistan, we're still very young, but we're becoming more and more mature society. And the first cause of a cancer is age. The older you are, the more you are prone to cancer. The second reason is changing of a lifestyle. Our lifestyle has become very fast in terms of food as well. We're loving fast food. And the next thing is environmental. The environmental issues, we're having too much ultraviolet, we're having not fresh air, and all of this can be in combination one of the factors. But traditionally in all countries, including Uzbekistan, the biggest risk factor of cancer is smoking, alcohol consumption. These are the most common causes of cancer.
Electronic cigarettes are also included, right?
Everything that you smoke is harmful, but there's a term, harm reduction. Okay, if you put it in a caterpillar, so the most harmful is cigarettes, traditional cigarettes, which we burn, and the second part is electronic cigarettes, because they also burn tobacco, but in tobacco, the cancerogens are not within the tobacco. It's from the burn. You know, you burn it and you inhale it, and then you get the cancerogens. And the third one is vapes, and the fourth one is chewing nicotine. So this is in this level, but all of them are harmful. If you are smoking, quit. If you have never smoked, never ever taste it.
Could you break the stereotype among teenagers who smoke those vapes and electronic cigarettes, who consider this as not harmful for their health? And maybe you could provide any cases, oncological cases that were brought from those electronic cigarettes.
Electronic cigarettes. Electronic cigarettes are very young. Okay, we haven't came to a position where we could. Most of the cancer cases are driven from elder people. Yes. Elder people are the most conservative people. So if they smoke this kind of cigarettes, there's no way that they would go to electronic cigarettes. So we have to come to, we need a certain time to wait until those people who think that the electronic cigarettes are not going to harm will come to our practice, and we will document them as people who got the cancer from smoking. But this data is not available. But this is the worst part of tobacco consumption. It's like you get the benefit now, like you smoke it and you get this benefit now. But in order to harm you, it takes a lot of time. That's why people say, no, it's not gonna touch me, because here you go, I smoke and nothing happened today or tomorrow. That's why they have this very wrong concept, wrong understanding of harmlessness of tobacco consumption. But overall, it's a big tragedy. What we need to do is we need to restrict smoking in public places. Like you see people smoking here in public places and it's admitted as a normal. Then we have to increase the amount of the cost of the cigarettes, so that teenagers or youngsters who are not that rich yet could not afford themselves buying cigarettes. And then we need from the increased top of the money of the cost of a cigarette, we need to spend it on propaganda of a healthy lifestyle and combating the cancer. This would be the best model that is used in all over the world.
How do you envision the future of the healthcare sector in about 5-6 years in Uzbekistan?
Well, in 5 or 6 years, I think we would be actively working on implementing high technology methods of diagnostics and treatment into our protocols. Because what are we doing now is we are solving the baseline problems, like digitalization, lack of protocols, not using the clinical guidelines in their practices. So all these things are baseline problems. Once we solve it, hopefully in 1 or 2 years, and then once we test it, then our task would be focusing on high-tech, supernova, innovative methods of diagnostics and treatments, and we would be thinking of implementing it into our healthcare services.
How about oncology? How do you vision it?
The same. I think in 5 or 6 years, we will finish up the implementation of laparoscopic surgeries throughout Uzbekistan. And we would be thinking of implementing robot surgeries as a pilot. We're doing laparoscopic as a pilot now. We would have more survival rates because we would find more patients in early stages. I would expect increasing of the beds of oncology throughout the whole country, because as I told you, population gets older, the incidence rates of a cancer would drastically increase. And other non-communicable diseases and communicable diseases as well, they would be prevented so much that people would not face those diseases, and there would be more and more people living up to their cancers.
I see. Thank you so much for such fruitful interview. It was a pleasure for me to talk to you.
Thank you very much. Thank you for the invitation.
So here our analysis comes to an end. Thank you for watching this program, and see you in the next episodes.
you.